Hi everyone, good evening and welcome to the Terumo Learning Edge Radial First Go Everywhere with Glidesheath Slender. My name is Jennifer Masabini and I am a Senior Education Manager here at Terumo. I'm joined here with my colleagues Ellie, Ilka, Yara, and Sydney supporting the virtual side of this recording. I have a few housekeeping items that I would like to go over. First, this presentation is intended for US physicians only. Products may not have regulatory approval in all countries, so please contact your local sales representative if you have questions about the availability of products in your area. This will be a recorded roundtable discussion, so if you have any questions regarding the topics discussed or looking for any further Terumo education opportunities, please visit us at www.terumois.com or reach out to your local sales and clinical representatives. We have a great event planned this evening, and leading the discussion will be Terumo's Senior VP, Chief Medical Officer, Dr. Michael Martinelli. Dr. Martinelli is an interventional cardiologist with over 20 years in practice, and I would say probably one of the true pioneers in radial access. So with that, thank you all for joining us tonight. And Dr. Martinelli, the floor is yours. Thank you.
Thanks, Jen, and hi, everybody. And thank you for giving us your time this evening. We have a real esteemed panel to discuss something that's near and dear to our heart here at Terumo, and that's radial access. First, we'll start out by making some introductions. So why don't we go around the horn and introduce ourselves. I'm Mike Martinelli, as Jen said. I'm the Chief Medical Officer for Terumo. My experience is in interventional cardiology. And then we'll go to Dr. Peebles.
Hi, I'm Todd Peebles. I'm a neurointerventional radiologist in Wisconsin. I've been doing neurovascular procedures through the wrist for about 6 years.
Great. And Dr. Resnick is next.
Hi, I'm Dr. Neil Resnick. I'm an academic interventional radiologist in Atlanta, and I've been doing radial access for just over a decade now, 2012.
Great, welcome, thank you. And Dr. Zhiroff.
Good afternoon, I'm Katrine Zhiroff. I'm an interventional cardiologist in Los Angeles. I've been doing coronary procedures through the radial since 2012 and peripheral vascular procedures probably in the last 5 years or so.
Thank you. And last but not least, Dr. Skripochnik.
Hi, Eddie Skripochnik, vascular surgeon in New York, New York Presbyterian, Columbia. I've been doing peripheral interventions from the wrist since about 2016-ish.
Great. So moving along, I think we're having this conversation tonight primarily because of the Glidesheath Slender and its 10th year anniversary. I don't know if everybody was aware of that, but it's been around for 10 years. And I know that you all use hydrophilic, that came up in the best practice, hydrophilic sheaths. How do you feel about the Glidesheath, and do you use the Glidesheath? And why do you trust the Glidesheath and maybe possibly over other potential access sheaths? Anybody?
I do use it every time, actually. I think it's very consistent. It takes all the turns that you need it to turn. I like that when you give it a wipe down before going in, it's very, very smooth on the way in, and the patient is for the most part very comfortable. And then it's an easy push.
Great.
Yeah, the transition between the introducer and the sheath itself is it's perfect and seamless. It goes in without a struggle virtually every time.
I like the resistance to sort of fracture, even if it kinks, you straighten it with a wire and it's sort of reliable. You don't have to worry about it being damaged.
Yeah, that's an important aspect, I feel too.
Yeah, I think for me, it's the same, just the reliability of this product, just like the rest of Terumo products. I have never had a problem with the sheath. I've used it almost exclusively, and I know it's anecdotal, but a couple times where I've tried other products, I have had some issues. So just went right back to the Glidesheath Slender.
Do you think there's any benefit from the fact that the coating stays on longer or it's functional longer, so that potentially you can start the practice and finish the practice with a relatively slick sheath? Have you noticed that, or do you think that's of any benefit?
I have, because again, like I mentioned, there are times where I won't even use a cocktail, and I've still found that by the end of the case, it just comes right out very, very smooth.
Great.
And as opposed to other, I've used other sheaths. I've never experienced it with a glide sheath, but other sheaths, if you do have spasm and you get into a situation or you're having difficulty removing your catheter, other sheaths may get stuck and stretch a little bit, and I've never experienced that ever with the glide sheath.
Great. So we're all using hydrophilic. The coating is important, and it's best practices. Would you guys agree with that? Yeah,
Definitely.
all right. There's a question that came up about, we talked about this a little bit in this previous segment, and that is competitor sheaths. Is there a way, is the glide sheath worth defending, and why and how would you defend a glide sheath if that came up, with regard to using another sheath, maybe not as with a coating that's not as complete on the sheath or last as long or as durable? How would you view that?
I
Yeah,
feel
it
like
comes down to ease of removal, I think, and insertion.
Yeah, and exactly, and for me, and certainly we have our vascular surgeon, expert here on the call, but it's all about the patients at the end of the day, and if I can feel more confident that is going to come out and not cause the spasm and not cause a problem with the radial artery, I'll take that every time.
Great. So when you're teaching fellows or teaching other physicians, instructing other physicians on radial access, and you're talking about the radial sheath, primarily you're talking about the hydrophilic nature of the sheath, the fact it lasts pretty much for the whole procedure, depending on the length of the procedure, its durability, and it's also use of the hydrophilic sheath is also really, best practices overall for radial. So I think that kind of speaks for itself. Well, thanks so much, everyone, for all your time and your expertise. We really appreciate it. I think that these types of discussions are really beneficial for our audience, and we're certainly grateful to have real champions like yourselves. So thank you very much, and we really appreciate all the time you spent.